I wanted to talk about a couple of statements that I got from your book. One of the quotes says, "People in dire situations can navigate a healthier path when every person in the intimate support system does their part." So what is this part that these people in their intimate or their circle of trust can do to help a person who's struggling with PTSD, depression, anxiety, or even unrelated to military, just trauma in general, which is kind of the language of the world?
What I mean by that is, and as you can relate to in your experiences, whether it be in a team, sports, or even the military, is the importance of everyone in that team taking an equal share of accountability. And so the reason I relate to that is the intimate family union. Okay, and I call it the coalition, especially in the very early stages of someone struggling and trying to get them help. Is the coalition are the people who've been identified and vetted, and they don't necessarily have to be family members per se. These could be a good friend, this could be a cousin, this could be a spouse. And these are the people who are going to be most intimately involved and are decision makers and the people who aren't going to stray away from the vision. Mm-hmm. And so I tell them that let's say there's a family of four, maybe a husband, a wife, a mom and dad. And I said, no matter what, who did what, that struggling loved one, whoever it is, moving forward, if you want to make change, you all moving forward have to assume 25% responsibility, work 100% on that share. What I mean by that 25%, because everyone contributes to some degree. There's a saying in the recovery arena, the 3 C's, you didn't cause it, you can't cure it, you can't control it, but on some way you've perpetuated, or what we call enabled it, on some form or fashion. You could have, of course, the struggling loved one who may be struggling with trauma and substance abuse and refusing to get help. That's their 25% that they need to obviously work on. Maybe you have a father who grew up in a culture or a household where weaknesses were viewed as emotions and it causes problems. That's his 25% he has to work on. And maybe the mother over nurtures and over supports their loved one and bails them out in uncomfortable situations, and that causes problems. That's her 25%. And maybe the spouse maybe has his or her own substance abuse issues, and that causes problems. And so that's the 25% he or she has to work 100% on. And so it's an all hands deck approach. And that's where you see the most maximization in anything. It's not, there's this correlation a lot that the person that's done the most harm or who's done the most destruction is the one that has to do most of the work. And that model, as you can imagine, very disabling and can become dysfunctional and counterproductive.